This is Dr. Sibley. We're doing a cataract surgery today. This patient is legally blind, and we've given them some medication. They don't feel this, they don't see this. They're laying down comfortably, and I'm sitting at the head of their bed. This is the patient's left eye, and at that position I'm touching the eye with a diamond blade. That diamond blade is adjusting the astigmatism. This patient has a very gray cataract. You can see it inside the circle of the pupil. I've just entered with my left hand, and I'm going to fill it up with a capsule stain. That capsule stain will color the layer of the cataract. The cataract is kind of like a lima bean. The lima bean skin is very tough and hard to visualize. This is a clear jelly. This clear jelly is now filling that chamber of the eye, and it's pushing the blue food coloring dye out. We don't need that anymore. So we have colored the skin of the cataract, kind of like the lima bean skin, and the right hand is going to enter with a 2.5 millimeter entry blade, and then my right hand is going to use an instrument to grasp the cataract capsule, and that cataract capsule is being opened in a circle, kind of like a manhole cover, and we're going to get the lima bean skin, if you will, removed and an opening made, and then the gray cataract can be popped out of that cataract shell. I'm going to do that with a little bit of water in my right hand, and you can see it pop up, and it's very gray and it's very cloudy, and this patient was legally blind. This instrument is a tiny straw with a big name, phacoemulsification. It has water flowing in, it has a vacuum flowing out, and it has an ultrasonic tip on it, and that vibration will emulsify or liquefy that cataract. You can see that the cataract is being liquefied and vacuumed out with that instrument in my right hand, and so the cataract now is 90% gone all through that one straw. And that straw is finished, and I'm just going to show you that inside that remaining capsule bag, it's kind of like a Ziploc, and it's got a little bit of fibrous cloudiness, and that's kind of like a little wisp of cotton candy all around inside that. So it's kind of like a Ziploc that's still a little dirty inside. This straw in my right hand is removing, again with vacuum and with the salt water flowing in, but no ultrasonic. It's grasping onto those little wisps of cloudiness, the particles of the cataract that remain. There's still some down in the clock hour at the 4 o'clock and the 3 o'clock where my straw is, and maybe some more at the 2 o'clock. And so I'm just going to make sure that I remove all of those and make sure the entire bag, if you will, the Ziploc bag, is 100% cleaned and free of any cells that might regrow. Cataracts do not regrow, but that capsule bag can turn cloudy later, and we can cure that with a laser. But right now we've tried to remove 100% of the remaining particles, and that right-handed straw has done that, and the particles are removed. I'm just pointing that it's all gone, and you can see there's a little edge of the open capsule that you might be able to detect in a circle. And this is a diamond polisher. This little buffer is going in. It's touching the inside lining of that bag, kind of like polishing dust off a Ziploc bag. And the left-hand instrument is sometimes squirting more fluid. Remember that clear jelly that I put in? I'm putting in some more of that clear jelly, and it fills the space again. And now I have a full space. I take that small blade and increase it to about 3 millimeters, very small, and the lens implant's going to fit through there. The lens implants are going to be inserted with two instruments, and the instrument in my right hand will grasp the lens implant. This lens implant is the round circle that you see, kind of like a contact lens, a soft contact lens, and two little arms on it on either side. They're made out of nylon, kind of like fishing monofilament. You're going to see that each one is very flexible, and it acts like a shock absorber. And you can see that it's so simply bent and pliable and soft that we can just fold it, and we're going to put it right back in there like putting a letter in a letter slot. So there we go, and that lens implant now opens back up instantly. So we folded it like a taco, and now it unfolds instantly, and the right-handed instrument just puts that second shock absorber right back into the capsule bag. So everything's back in the capsule bag where the cataract was. So right now the lens implant, the artificial lens, custom ordered for them, is in his prescription, and it's right back where Mother Nature had it. That clear jelly, the straw again vacuums it out and fills the eye with salt water again. And just to make sure there's no particles in there, we're just going to insert a little more salt water, and then I inflate it to make sure it's kind of the normal pressure. And we have the lens implant that's replaced the cataract. It's centered. It should stay centered forever, and it should stay clear forever. And then just to make sure that it's protected all night, we just put a contact lens on the eye. That's made out of protein. It's been soaking in an antibiotic solution, and there's the solution. And I'm just making sure that with my left hand then that we make sure the pressure is normal and equal. That contact lens will melt in the next few hours and soak the eye in antibiotics to keep it safe. And we just remove the eyelid spreaders, and the operation's all done.